Our benefits program is just one way Cal Poly Humboldt and the CSU system are committed to your success and well-being. The following list of benefits and services are available to full-time and some part-time employees. We'll talk about each one in more detail. Cal Poly Humboldt offers you and your dependents an array of health benefits. This is a brief introduction to the medical, dental, and vision insurance benefits. We offer employees a choice of 5 different health plans, with an additional option for those living in Del Norte County and another for members of the Peace Officers Research Association of California, also known as PORAC. The premiums for these plans are deducted monthly from your pay warrant on a pre-tax basis. What's the difference between a preferred provider organization, or PPO, and a health maintenance organization, or HMO? Generally speaking, the differences include out-of-pocket costs, ability and ease to see specialists, and coverage for out-of-network providers. Let's review each type of plan separately. Our HMO plans allow access to a network of doctors and hospitals within California. Under these plans, you are required to have a designated primary care physician, or PCP, that will coordinate your healthcare needs. This means that you will need a referral to see a specialist or to have certain medical tests done. Under our HMO plans, you are covered for emergency room and urgent care visits, even if you are outside the service plan area. The 3 available HMO plans have almost identical coverage, but the provider networks may be different. We advise employees to review the summaries and evidence of coverages for each plan, especially if they have specific medical conditions or ongoing prescriptions that will need to be covered. Our HMO plans do not have deductibles, and many services are covered at 100%. These are the current copays for routine doctor and urgent care visits, prescriptions, and ER visits. The PPO plans also have a network of doctors and hospitals, but you don't need a primary care physician referral to see other doctors or specialists. PERS Platinum does not have the same geographical restrictions as the HMO plans, as the networks are nationwide. PERS Gold, however, is available only in California. PPO members can be seen out of network and have coverage, although they will pay a higher percentage of the cost and be responsible to pay the difference between the contracted rate of an in-network provider and the cost of the service that the out-of-network provider charges. There are deductibles associated with these plans, which must be met before the health plan pays for services. There is also co-insurance associated with the PPO plans, which means that the health plans will pay a percentage of the bill for the covered service, and the member will pay the remaining percentage. These are the current copays for routine in-network doctor and urgent care visits, prescriptions, and emergency room visits. We have 2 dental plans available for employees and their eligible dependents: Delta Care HMO and Delta Dental Enhanced Level 2 PPO. Delta Dental is widely accepted by providers locally, whereas Delta Care is not. Although subject to constant change, there aren't any providers in Humboldt County currently accepting Delta Care. For a list of dentists who accept both dental plans, please use the Find a Dentist tool on the Delta Dental website. Please note, when looking for a dentist who accepts Delta Dental, we have access to providers in both the Delta Dental PPO and Delta Dental Premier networks. The premium for dental insurance is paid in full by the CSU, meaning there is no additional premium withheld from your pay. Please refer to the comparison chart for a list of covered common services and coinsurance information. Enrollment into the Basic Vision Plan through VSP is automatic and covered in full by the CSU. It provides an annual wellness exam and an allowance for contact lenses or new glasses every other calendar year. We encourage you to shop around before purchasing glasses or contact lenses. Usually, non-provider reimbursement rates are less, but the price of the product could be significantly lower, saving you on out-of-pocket expenses. Employees have the option to upgrade to the Premier Vision Plan, which adds a higher allowance for contact lenses or new frames or lenses every calendar year. The Premier Plan does have a monthly premium that will be deducted pre-tax from the employee's pay warrant. Enrollment into the Premier Plan can be completed by sending in an enrollment form within the first 60 days of hire or permitting event, or during open enrollment. Employees who are eligible for medical and dental insurance and have other non-CSU group coverage can elect to waive CSU coverage in exchange for a monthly cash payment. Flex cash payment is treated as taxable income and is subject to payroll taxes. Every 3 years, employees with covered dependents are required to provide documentation re-verifying these dependents, or they will be dropped from coverage. You will receive several reminders from CalPERS and Human Resources prior to the deadline. We encourage employees to review the summaries and evidence of coverage documents for each plan prior to making enrollment decisions. It is important that the plan you choose works well for you and your family. If you have any questions, please contact our benefits team.